Good afternoon. My name is Dr. Wendy Braund, and I have the pleasure of serving as the Deputy Secretary for Health Preparedness and Community Protection at the Pennsylvania Department of Health. It is a pleasure to be in the Capitol today to bring attention to viral hepatitis with a spotlight on the necessity of legalizing syringe services programs. First, I would like to thank the partners standing here today and across the Commonwealth who work to educate, support, and empower Pennsylvanians living with hepatitis day in and day out. In the United States, the most common types of viral hepatitis are hepatitis A, hepatitis B, and hepatitis C. Viral hepatitis is a costly and preventable disease. Generally, hepatitis means that there is inflammation of the liver, and this could progress to liver damage. When the liver is inflamed or damaged, its functions can be affected. Heavy alcohol use, toxins, some medications, and certain medical conditions can cause hepatitis. However, hepatitis is often caused by a virus. Despite our best efforts, we are seeing new infections increasing each year among Pennsylvanians who use drugs. The good news is that there are vaccines available to prevent hepatitis A and B and medications to support hepatitis B and C. To support these efforts, the Department of Health worked in partnership with the Pennsylvania Viral Hepatitis Eliminating Planning Committee and the Viral Hepatitis Interagency Work Group to create a viral hepatitis elimination plan. Dr. Truskin and Dr. Cohn, who join us here today, are involved in this committee. Together, we are proud to share our goals to drive short-term and long-term change. And those are to create and enhance prevention and education initiatives, to expand the availability of co-located viral hepatitis and harm reduction services and programs across the state, to increase testing and linkage to care and treatment, and to continue surveillance of those diagnosed with hepatitis B and C. This is critical work. We estimate that 4 in 10 Pennsylvanians living with hepatitis C are unaware of their infection, and 7 in 10 with hepatitis B. That's why we must continue our best efforts and do more. Do more to bring awareness, just like we're doing today. Do more to break down barriers around testing, diagnosis, and treatment. Call on our legislature to do more, to provide this service as an option, to bridge a pathway to treatment for everyone, like the efforts to legalize and expand syringe services programs in Pennsylvania. Thanks to syringe services programs in Pittsburgh and in Philadelphia, many Pennsylvanians have found their bridge to treatment and other social services that helped them overcome substance use disorder. Syringe service programs are an invaluable resource to Pennsylvanians struggling with addiction. These efforts are driving significant overall reductions in injection-related HIV and hepatitis B and C cases by removing contaminated syringes from circulation. Representatives from the Departments of Health and Drug and Alcohol programs traveled recently to hear the stories of those who have lived experience with syringe services at the local level, and from those who are passionate about getting help to those in need. They heard that by providing access to clean syringes and other medical supplies, as well as helping them with the safe disposal of needles, disease testing, drug treatment referrals, and other health services, they were able to offer a bridge to recovery for some individuals. That's why we are hoping to expand these programs and services to other areas of the state. Again, for our fellow Pennsylvanians trying to find their way to support and recovery. However, syringe services are not legalized across the state. Pennsylvania is just one of 10 states that do not allow wide access to syringe services. 40 other states have access to this treatment tool for their residents. This means that we are missing out on potential federal funding that could support such services. Syringe services are not for everyone, but there are people that could benefit from a trusted resource who provides them a safe, controlled environment to support their journey. The Wolf administration worked closely with members of the General Assembly to develop Senate Bill 926 and House Bill 2264, which would allow additional organizations outside of Pittsburgh and Philadelphia to engage in syringe services work. At this point, we have 166 organizations, including those here with us today: the Allegheny Health Network, Philadelphia Fight Community Health Centers, Hepatitis B Foundation, Clean Slate Recovery Centers, Pennsylvania Harm Reduction Network, Armstrong, Indiana Clarion Drug and Alcohol Commission, Incorporated, Pennsylvania Association of County Drug and Alcohol Administrators, Gadenzia, and the Pennsylvania Medical Society. These organizations and others across the state are signed on to support expanding syringe services programs and to help save lives. We're grateful to have Kate and Stephen here today to share their stories. After all, the root of why we are here today is to focus on the person, our fellow Pennsylvanians that may benefit from this pathway, a bridge to treatment and other social services that help them overcome the disease of substance use disorder. And with that, I would like to introduce you to our next speaker, Dr. Stacy Truskin, Chief Medical Officer, Philadelphia Fight.
Thank you, everybody, for the opportunity to be with you today. I'm going to focus my remarks on hepatitis C virus. I know Dr. Cohn, who's with me today, will focus on hepatitis B. Hepatitis C is the most common bloodborne infection in the United States, and 40% of Pennsylvanians who are living with hepatitis C are unaware of their infection. A whole new generation of Pennsylvanians are being infected with hepatitis C as a result of the opioid epidemic. The highest number of new cases of hepatitis C are among individuals aged 20 to 39. It doesn't have to be this way. Hepatitis C can be both prevented and cured. Medication for opioid use disorder, as well as access to safe injection equipment and other harm reduction services, have been shown to reduce hepatitis C transmission. In Pennsylvania, these services are often difficult to access and sometimes impossible to find. We must do better. Low barrier services are needed across the state. Low barrier means geographically accessible, free of charge, free of bureaucracy, and without stigma or criminalization. We now have a cure for hepatitis C in less than 8 to 12 weeks of treatment with 1 to 3 pills, 1 time a day, and nearly no side effects. 95% of folks can be cured. And yet, we do not have enough treaters. We need integrated models of care that bring the cure to the patient and do not require the patient to traverse a difficult healthcare system in order to access life-saving treatment. That means that hepatitis C cure should be offered in primary care settings, in settings that treat substance use disorder, and in harm reduction settings. It means that providers should be able to prescribe hepatitis C treatment the same way we prescribe treatment for asthma, hypertension, diabetes, and HIV. But providers must currently complete a prior authorization so that the insurance company will approve it, and then the medication must be dispensed through a specialty pharmacy. This creates an undue burden on the provider and a delay in treatment for the patient that can sometimes be critical. If we are going to eliminate hepatitis C from Pennsylvania, we need a test and treat model. We know that treatment reduces all-cause mortality and mortality related to hepatitis C. We know that it improves the damage that has been done to the liver by hepatitis C. And yet treatment does not just benefit the patient, it benefits the whole community. Treatment is prevention. You cannot give someone something that you yourself no longer have. That means that a cured individual will not share the virus with an injection partner, with a sex partner, or with a child at birth. In the setting of Pennsylvania's opioid epidemic, we must prioritize treatment for people who inject drugs without needless bureaucratic hurdles, without blame, and without stigma. We can eliminate hepatitis C from Pennsylvania, I'm sure of it. The Department of Health, the Elimination Planning Steering Committee, and our statewide coalition, Hepatitis Free PA, are off to an amazing start, but we need your support. We need to fund Pennsylvania's elimination plan. In order to eliminate hepatitis C from Pennsylvania, we must have resources to scale up testing, to scale up treatment, and to scale up access to cure. We need scaled up access to harm reduction services. We need legalized and funded syringe service programs. We know that these things work. We've seen it in Philadelphia, and we can see it across the state. Thank you.
Thanks, Dr. Truskin. Thanks for being a part of this effort. Another advocate joining us today is Dr. Sherry Cohen, who serves as the Senior Vice President of the Hepatitis B Foundation. Dr. Cohen.
Well, thank you. Thank you very much. I am very happy to be here today as we are completing Viral Hepatitis Awareness Month in May, Asian American Pacific Heritage Month also in May. I am so pleased that we now have a statewide viral hepatitis elimination plan. We are one of only a handful of states in the US that have such a plan, and we have hundreds of people across the state working in public health, academia, community organizations, and healthcare systems who are ready to implement prevention, screening, and linkage to care programs to help thousands of people who have hepatitis B and C. Hepatitis B is one of the world's most common serious liver infections. 2.5 million people in the US have hepatitis B, and 50,000 Pennsylvanians live with hepatitis B, though 70% don't know it. Without appropriate screening and linkage to care and treatment, up to 40% will die of liver cancer. And we have a safe and effective vaccine. Right now, we do an incredible job vaccinating babies who are born, but so many adults across the state do not have protection, and they are at risk for hepatitis B infection. Hepatitis B is a Pennsylvania story. The virus was discovered in Pennsylvania. The first vaccine was invented in Pennsylvania, and the vaccines are still manufactured right here in Pennsylvania. We can take the lead. We can be the first in the US to eliminate hepatitis B and C with the will, the funding, and the resources to get people screened, into care and treatment, and vaccinated. Thank you.
Thank you, Dr. Cohen. Next, we will hear Kate's story. Kate Favada is a community relations liaison for Clean Slate Recovery Centers. She has traveled across the state to share her story.
Hi, everybody. My name's Kate Favada. I'll give you a little bit of background. I was a Pennsylvania who injected drugs, and I also had the hepatitis C virus, so I guess I'm in the right place. Okay, I'm not a public speaker, but I do it for people that don't have a voice. I feel like as somebody in recovery, it's my responsibility to come out and talk to people about this, about Senate Bill 926. Thank you to everyone who supported it. I work for Clean Slate Centers. We definitely see the benefits of syringe service programs. We know it cuts down on overdose deaths, and it bridges people to treatment and health services that are so desperately needed. So my story, I grew up in Wilkes-Barre, Pennsylvania. I ended up in my late teens in Philadelphia. I was injecting at the time heroin. I walked into Prevention Point thinking that it was just a place where I could get clean syringes, and I was very wrong about that. One of the things I learned there was how to be responsible. Nobody said to me, "We're putting our seal of approval on you using drugs." They just pretty much said to me, if you're gonna use drugs, be responsible and do it the right way. I know I wouldn't be standing here today if it wasn't for programs like that. People like me, at the time, I had track marks up and down my neck. I had endocarditis, at the time, Hep C. And coming from like a small town in Pennsylvania, what really stuck out to me at the time was people that utilized these programs didn't have hepatitis C like I was used to seeing. And that was a direct result of Prevention Point in Philadelphia. They did testing for hepatitis C. They also do HIV treatment, HIV testing, medication-assisted treatment. So I just wish some of the people that passed away would have had the opportunity to utilize those kind of services. So at the time that I went there, they also educated me on being responsible, thinking about first responders, disposing of my syringes in the right receptacles. So I just think that it's long past due for these programs. I wish that everybody would have access. So my hometown is Wilkes-Barre area, and I meet with politicians and law enforcement type people, first responders. And when I talk to them, I ask them what would make them back this. And they say, "Kate, we would support this if it was legal, you know?" And by legalizing this, you're not saying that you approve of drugs. You're just saying you love people and you're not going to judge them based on the decisions they make. So thank you so much for letting me come here today. I'm honored to be here, and I'm saddened that so many people didn't make it here because they didn't have access to things like these. Thank you.
Thanks for sharing your story, Kate. We are also joined by Steve Murray, who is a local Harrisburg resident. We appreciate you being here today to share your lived experience with hepatitis C. Steve?
Alrighty. Thank you, Bill. Good afternoon, all. My name is Stephen Paul Murray. As you see, I don't have nothing written down, but it's all in my heart. I'd like to thank the researchers for starting something that came into fruition for me. Because when I found out in 1994, I could have used some prevention, even working in the nursing field. And I also acquired Hep B, And but to get to 2015 in Philadelphia, University of Penn, and found out that they could eradicate. Because in '09, when Dr. Goldman tried the interferon, it didn't eradicate. That's when I learned that there's A to J genotypes, and the African American genotype could not get eradicated, Hep C, due to interferon. And thank God, they did make medication to eradicate it. And also had the opportunity to get the hepatitis B eradicated. And so to be able to stand and now understand the part I need to do what the Commonwealth of Pennsylvania Department of Health is doing, I need to learn the prevention, because I can acquire Hep C again. And so, to God be the glory. Thank you.
Thanks for your story, Steve. This reiterates the importance of testing and prevention efforts. Next, we will hear from State Representative Sarah Innamorato, who is the primary sponsor of House Bill 2264. Thank you. Beautiful pronunciation.
I always have to have papers in front of me, so. Good afternoon, everyone. I believe with lawmaking, you have to find the balance between the head and the heart. And we've heard all of the reasons why this is good public health policy from our public health research and our medical doctors. But we've also heard the deeply personal stories on how drug use impacts people across the Commonwealth. And I have to say, I came to this issue through my heart. Since entering office, I've talked a lot about my father's struggle with opioid addiction, the turmoil his addiction caused my family, and how his death left a huge gaping hole in our hearts. Once I opened up about my lived experience, I had constituents and lawmakers and people like Kate and folks who are here with us today who talked about their lived experiences and the ways that drug use impacted their lives and their loved ones. And they all share a desire to find a more humane and effective way to help those with substance use disorders other than just incarcerating them. That's why, since I've been in office, it's been a priority of our district office back home in Pittsburgh to partner with the county and addiction service providers to offer free Narcan and advocate with our first responders to legalize fentanyl test strips. But we know we need more. We need action at the state level. That's why, together with my Republican colleague, Representative Jim Struzzi, I've introduced the House Companion Bill for legislation that will legalize syringe service programs across Pennsylvania. This legislation builds on the work of a unique and diverse set of stakeholders committed to public health policies that will save lives. Supporting harm reduction policies and programs is my commitment to my dad's memory. But it's also my commitment to my neighbors who've lost their loved ones and families members who loved them dearly. With overdose rates on the rise, it's more important now than ever to deploy compassionate, evidence-based harm reduction programs across Pennsylvania, like syringe service programs. But a lot of people don't know what that is. Like many people across the Commonwealth, I didn't know what harm reduction meant. It was a new term for me when I began looking for ways that I can volunteer to help address the opioid epidemic at a community level. So for me, volunteering with my local syringe service provider, Prevention Point Pittsburgh, is where I first learned that harm reduction is a set of practical strategies and ideas aimed at reducing negative consequences associated with drug use. As a volunteer, I did provide people with clean syringes, but I also felt like I was creating a space where people who used drugs, they felt safe. They didn't feel any judgment. And we created a dignified place where people had access to services and resources. And as you've heard today, syringe service programs currently operate in Pittsburgh and Philadelphia in our urban cores, but are illegal throughout the rest of the Commonwealth. And because people who use drugs live all across the Commonwealth, syringe service programs must be available to any person who needs them wherever they are, whenever they need them. SSPs provide access to clean syringes and other medical supplies, needle disposal, referral to drug treatment, disease testing, and naloxone and other health services. Those fighting opioid addiction cannot recover if preventable diseases or overdoses first take their lives. SSPs help give our neighbors a chance to recover. These programs are vital for Pennsylvania as overdose deaths and spread of disease tick upward, especially in our rural areas. Because in addition to Pennsylvania having the third highest rate of drug overdose deaths nationally, the third highest, viral infections are also on the rise. We have the 9th highest rate of new human immunodeficiency virus, HIV, infections. And in addition, a recent report highlights Pennsylvania's inadequate and insufficient efforts to fight hepatitis C. But we have the answers. We know how to stop this. Numerous studies have shown that access to sterile syringes reduces HIV, hepatitis B and C transmissions, and other blood-borne pathogens in people who inject drugs. We have an opportunity to act now and legalize syringe service programs once and for all. And once syringe service programs are able to operate across this Commonwealth, service providers will be able to pull down federal dollars to fund these life-saving programs. And with programs like these set up in our urban cores and our rural areas, public health professionals will save lives and reduce the spread of disease related to injection drug use. The overdose epidemic is far from over. But I am committed to working with lawmakers across the aisle, across sectors, and across this Commonwealth to pass policies that keep people from dying while we work towards long-term solutions to actually address holistically the overdose crisis. Thank you to everyone who's here. Thank you for allowing me to speak.
Thank you, Representative. Next, we will be joined by Representative Dan Frankel. Representative Frankel serves as the House Health Committee Chair. Thanks for joining us today, Representative.
Good afternoon. Thank you for the introduction, and thank you for the opportunity to be here. And I want to thank the personal stories that we heard today, and particularly my colleague, Representative Innamorato. I've listened to her story. She has helped us here in the legislature who may not have had the personal experiences understand the depth of the problem and how it affects our families. And her advocacy and working in a bipartisan way with Representative Struzzi, who also has shared his personal story, is very powerful, and I hope will be able to be the energy that gets this across the finish line. For too long, our state and federal public policy has been centered around punishing individuals suffering from addiction. But the data is in, and the strategy is not only a failure in deterring drug use, it also represents a dire threat to our public health. Local leaders in Philadelphia and Pittsburgh have long known that the dangers of IV drug use to individuals and communities are too urgent to wait for state lawmakers to officially permit the use of syringe service programs and other harm reduction strategies. So despite a statewide prohibition on needle exchanges, they are available in our two largest cities. But we all know that drug use is not only a city problem, it's an everywhere problem. And where you have IV drug use, you have viral hepatitis and HIV, and you have overdoses. In 2019, Pennsylvania reported the second highest count by state of newly reported chronic hepatitis C infections in the United States. An estimated, as you've heard, 4 in 10 Pennsylvanians living with hepatitis C are unaware of their infection. Not to mention, we are tragically one of the top 5 states for the most fatal overdoses. Smaller cities and rural communities desperately need syringe exchange programs to stem the spread of diseases and get services to people suffering from addiction. But our antiquated state laws continue to block them. I want to thank Representatives Innamorato and Struzzi for their important legislation to expand the use of proven public health interventions, including needle exchanges. House Bill 2264 will save lives and fight the spread of diseases. That's exactly what we should be doing here in Harrisburg. As so often is the case in public policy, the compassionate thing to do is the smart thing to do. Let's get it done. Thank you.
Thank you, Representative. The overdose epidemic is and has been a public health crisis. The crisis is fueling a dramatic increase in infectious diseases associated with injection drug use. In Pennsylvania, we have the 3rd highest rate of drug overdose deaths in the country and the 9th highest rate of new HIV infections. We need to turn that around. That's why we need to use every tool at our disposal. And we need to work to improve and expand access to these services across the Commonwealth. It is no longer enough to only have these services available through nonprofits in select parts of the state. We need to give other cities and regions across the state the ability to establish syringe services and to gain access to federal funds. That's why we are hoping to expand these programs and services to other areas of the state. Again, for the support of the individual, our fellow Pennsylvanians trying to find their way to support and recovery. Again, thank you to those of who are already doing this, saving lives and inspiring other communities. And thank you all for being here today. And I believe we are happy to take questions if there are any. Sir. Sure. So the question was about about whether there are syringe services programs in other parts of Pennsylvania. There are, in fact, some communities that host syringe service programs because at the local level, they have essentially decided to defy the law because they felt it was important to provide those services, and they have collaboration among the important stakeholders to make that happen. Philadelphia, now I'm no lawyer, just a doctor, but Philadelphia and Pittsburgh, because they are larger jurisdictions, are able to make their own laws that our smaller communities do not have the legal capability to do. So the question is whether there are syringe service programs in York, Lancaster, and Harrisburg. Yes, the answer is yes, I'm being told. And our comms folks can follow up with you as well on that. Other questions for myself or my colleagues? Okay, well, again, thank you all so much for being here today to bring attention and support these important efforts. The good news is that there are vaccines available to prevent hepatitis A and B, and medications to join us here today are involved in this committee. Together, we are proud to share our goals to drive short-term and long-term change, testing and linkage to care and treatment, and to continue surveillance of those diagnosed with hepatitis B and C. This is critical work. To continue our best efforts and do more. Do more to bring awareness, just like we're doing today. Like the efforts to legalize and expand syringe services programs in Pennsylvania. Pennsylvanians struggling with addiction. These efforts are driving significant overall reductions in from those who are passionate about getting help to those in need. They heard that by providing access to clean syringes and other medical some individuals. That's why we are hoping to expand these programs and services to other areas of the state. Again, for our fellow state, Pennsylvania is just one of 10 states that do not allow wide access to syringe services. From a trusted resource who provides them a safe, controlled environment to support their journey. Pennsylvania Medical Society. These organizations and others across the state are signed on to support expanding syringe services programs and
Thank you, everybody, for the opportunity to be with you today. I'm going to focus my remarks on hepatitis. Hepatitis C can be both prevented and cured. Medication for opioid use disorder, as well as access to across the state. Low barrier means geographically accessible, free of charge, free of bureaucracy, and without stigma or criminalization. We now have a cure for and do not require the patient to traverse a difficult healthcare system in order to access life-saving treatment. That means that hepatitis C, but providers must currently complete a prior authorization so that the insurance company will approve it, and then the medication must be dispensed through a specialty pharmacy.
Thank you very much. I am very happy to be here today as we are completing Viral Hepatitis Awareness Month in May. U.S. that have such a plan, and we have hundreds of people across the state working in public health, academia, community organizations, and healthcare systems who are ready to
Favada. I'll give you a little bit of background. I was a Pennsylvania who injected drugs, and I also had that don't have a voice.
as you see, I don't have that written down, but it's all in my heart. I like to thank the researchers when Dr. Goldman tried to interfere on it.
I came to this issue through my heart. Since entering office, I've talked a lot about my father's struggle with opioid addiction. I had constituents and lawmakers and people like Kate and folks who are here with us today who talked about their lived experiences and the ways that drug use impacted their lives and their saved lives. Supporting harm reduction policies and programs is my commitment to my dad's memory. But it's also my commitment to my neighbors who've lost their space where people who use drugs, they felt safe. They didn't feel any judgment. And it created a dignified place where people had access to services.
That's exactly what we should be doing here in Harrisburg. As so often is the